Today is May 14th, and I do not feel so good. I'm having to do more radiation than I thought I was going to this round. Instead of just doing 2 weeks, or doing 3 weeks. And it's really starting to build up in my system. And because it's on my neck, it's directly affecting my throat and like the top part of my back part of my mouth, and it's all very raw and sore, and it's hard to swallow. And it constantly feels like I'm choking on something a little bit, like something's stuck in my throat. I'm like gagging a lot, like just choking on nothing, especially when I try to sleep. I saw my regular oncologist yesterday, Dr. Ellis. She did some blood work and a chest x-ray because I've been coughing so much and I'm just feeling so poorly right now. And I didn't get any good news, unfortunately. The radiation is working on the sites that they're doing it, but other stuff is not getting better. She tested one of the specific markers she went over on my blood test was a special protein they use as a tumor marker. It doesn't show exactly how many cancerous cells you have in your blood, but it helps them to see kind of how much you have in your body, or how well or how effective whatever treatment you're on is, or if you're having a recurrence, the numbers will spike. My last blood work, that number was at 47, which is higher than the average. I guess on average, anybody at any time would show a value between 10 to 20 or something like that. My value was in the high 40s or 50s, I can't remember now, several months ago. Yesterday that value was 137. So it's more than doubled in a very short period of time. So she says that is really concerning, and it means we're going to have to make some changes because what we're doing isn't working. So once I'm done with the radiation, I have an appointment to see her in about 2 weeks, and I have to make a decision whether I'm going back on chemotherapy or if I'm going to try some other combinations of hormone therapy. So I'm leaning more toward the hormone therapy right now. It's not going to be great, but it's better than putting poison in your body, right? So we'll see. Hopefully that will be more effective. It looks like she's going to combine a couple of different things. So I guess we'll talk about those options once we get there. But that's probably what I'm going to be doing. I'm going to try some more hormone therapy first before I allow her to put me back on chemo. I did just get a call from her about an hour ago, and I have pneumonia apparently right now. They did chest x-rays because the cough was so much worse. They were concerned, and it shows that I've got a low-grade pneumonia on top of everything else. So that would explain why I feel so absolutely horrible the last couple days. And it's just getting worse. But I did get antibiotics yesterday, so hopefully that will start working soon. They gave me this hardcore heavy-duty cough syrup. I should show you the bottle. Like, how big is this bottle of cough syrup? And you only take like 4 milliliters at a time. Like, one of these full is 1 dose of this stuff. Who goes through 16 fluid ounces of this stuff? And this stuff is not messing around. This has got hydrocodone in it, and I took some last night, and it made me crazy. I was freaking out. It just makes me really, it's hard to describe. It's like there's creepy crawlies under my skin, and I get really agitated and anxious, and I have to do stuff. I have to try and do something with my hands or something to try and take my mind off of it, but it really truly makes me want to have a panic attack. Like once it kicks in, there's this moment of high, up in the air craziness, and then I'm like freaking out, and I'm fighting not having a panic attack. This stuff is terrible, absolutely terrible, and I don't feel like it helped that much with my cough. So it's all gonna get wasted. It's terrible. When she wrote the prescription for me and she told me there was hydrocodone in it, I was like, she's like, I know you don't do good with medication, but you're coughing so much and it's so bad. I want to give you something that might help you sleep. That doesn't help. It didn't help. So I'm just, I don't know, trying to get through it. I feel so terrible right now. So terrible. I don't want to do this anymore. I'm completely drunk, just completely wiped. Today especially, I have nothing left. I just have nothing. I can't even, I don't know. I just keep going one day at a time, right? It's gotta start getting better eventually. Probably wouldn't be so bad right now or so hard if I didn't have pneumonia. I don't even know how I caught pneumonia. How does that happen? Ugh, it's not like I've been out anywhere or like even all that social. I don't know how. Yeah, so that's where we are today. Not doing so good. Not doing so good. I'm still really sick to my stomach all the time. I've only thrown up a couple times this week so far, but I'm just constantly feel like I want to. Appetite is okay. Not great, but okay. I am managing to get food down at least, here and there. I probably get at least one good meal a day, I think, about. Kind of depends. The fatigue is just horrible, and I feel like I'm trying to operate on dead batteries or something. It's just horrible. The last few days especially, I'm so tired. So tired. And when I do finally try and get some sleep, I can't get like good restful sleep. It's just fitful and sporadic and disrupted by coughing or choking or fighting to breathe or something. It's always something. But the one good thing is that the pain is better. The pain in my neck has been pretty much gone. There's one spot on the right side up high that still bothers me off and on. But that's the one thing I can say that I haven't been dealing with a whole lot. Other than, the pain in my throat from the radiation and the pain in my lungs from all the coughing. But all the other, like, bone pain, that really bad disruptive bone pain has finally stopped, so that's good. Yeah, I'm just still dealing with so many symptoms, and the headaches will come and go periodically. The vertigo is still really bad, especially with the different kinds of medication that we're messing with, trying to help with symptoms. They always make that worse. I'm on a new kind of tramadol for pain control, and the prescription is two tablets like every 12 hours or something. I can take one every 36, and I'm still like, but it definitely stops all the pain, so it's a trade-off. Yeah, that's all I can think of. So I would love to get some more information as far to exactly, how things have changed, what things look like a bone scan and stuff. But I guess there's, a number of things they can tell just from the blood work and from the x-rays, because every every so many radiation appointments they do, because that big fat machine does a lot of different things. It does like, it does radiation, it does x-rays, and I think it does, I think it might do some kind of like CT kind of scan. I can't remember. But they do an x-ray or some kind of imaging with every so many radiation appointments to kind of monitor, you know, the area they're working on and looking for change and progress. And I guess that those have come back good, so that's good. Yeah, if I manage to beat this stupid pneumonia and get through the rest of this radiation, I should start feeling a little better, at least for a little while, before they change everything up, and then we'll have to do this all over again and figure out. I can't, I'm so tired, I can't even focus. Yeah, so hopefully once this whole thing is over and my throat heals and I get over the pneumonia, I'll have a few good weeks before they mess with my treatment regimen. So we'll see. I guess I'll keep you posted. Like I said, I don't know exactly what hormone therapy we're going to do right now, but that's what I'm leaning toward. And I don't know how long I'll be on that before we'll know if it's working or not. I assume if it's a few months, they have to. How long have I been doing this now? I have only been doing this since March. Okay, so a few months, and then they'll have an idea of whether that's working or not. And she says she's got a lot of different tricks she can try when it comes to the hormone therapy. So just because the first combination she puts me on doesn't work, if it doesn't work too, then there's a few other things we can try before I am forced to go back to chemotherapy. So let's hope one of those works, because I'm done. I'm really done with that level of misery that chemo brings. So, a big thank you again to everyone who's been so helpful lately. Getting to these last 5 appointments was kind of stressful and hectic, because I thought I was going to be done, and it wasn't. So it was kind of a scramble to get these needs for rides posted, and they're pretty much all covered. So thank you so much for everybody who's been able to take time and get me up there and get me home. It's been so helpful. Yeah, and just all the encouragement and everything from everyone it helps, especially on days like today when I want to throw in the towel and wave the white flag. It helps me keep going, to keep taking it one day at a time and know that it's going to get better eventually. And you got to keep a good attitude about it regardless. Because even though you can't control everything else, you can control that. That's something. So thank you for everybody that's helping me do that. Keep positive. So I will keep you all posted.